Just as Americans were gearing up for the busy holiday season, the Omicron coronavirus variant took the nation by storm.
Omicron is spreading very rapidly.
Countries around the globe already ringing in the new year, many deciding to cancel their celebrations with the latest Omicron outbreak.
Carriers canceled another 1,500 U.S. flights today, more than 3,000 delayed.
We're already up to over 800,000 deaths in the U.S. during the pandemic, and really concerned with the level of hospitalization.
While the U.S. has been well equipped with vaccines, boosters, and treatments to tackle the latest wave, one tool has been noticeably absent from its arsenal: at-home COVID tests.
In the U.S., there really hasn't been a home testing strategy rolled out, and really the role of home testing was discussed in a very limited way.
Now, when it comes to rapid tests, we have seen the supply of them increase over the last few months, but they are getting increasingly difficult to find as well.
We should have been ahead of the testing game, and unfortunately, we're always 2 steps behind.
We've had an unprecedented demand with Omicron, and then a lot of travel.
Here's how the U.S. fell behind on its at-home COVID testing strategy and what's being done to fix it. When it comes to diagnosing COVID-19, there are 2 main types of tests.
The PCR test is kind of our gold standard test. That test goes through a laboratory, and it takes several hours to get a result. The other test that we have is the rapid antigen test, and that can be done at a healthcare facility or a testing site. It also can be done at home.
So PCR tests have the advantage of being very sensitive. People think of the rapid antigen tests as being really good markers for contagiousness because they are only going to be positive if you have enough virus in there to trigger the limits of detection on the test.
The Biden administration has made it clear that rapid tests will be critical when it comes to reopening the U.S. economy. Back in January 2021, the president's national pandemic strategy called for a major unified federal investment in rapid tests to help reopen schools, businesses, and travel. More than a year later, buying an at-home test at your local drugstore remains a challenge.
The issue of when and how frequently you have to test is really a critical issue for these rapid tests. So right now we're at the peak of the Omicron wave. The risk is high. People are going to have to test more frequently.
The lack of easy access testing could be a problem. The country's vaccination rate has stalled, leaving pockets of Americans vulnerable to severe outcomes. Experts also point out that kids under the age of 5 still don't have access to an authorized vaccine. Even vaccinated Americans are testing positive for COVID-19. And researchers are trying to understand what that means for how well the virus spreads.
What we're seeing is our vaccines are not transmission blocked, that they may reduce the probability of someone getting infected. They reduce the probability that someone who's vaccinated, who's infected, can transmit the virus to people in their households and in the community. And that's really important.
If you live in the UK, you could order a pack of 7 rapid COVID tests in a single day for free. At-home tests only cost a few dollars at German grocery stores. But in the US, prices are on the rise.
There are 2 challenges that lead to some of the price issues that we see in the United States. One could be some of the failure to have these upfront purchasing agreements with the manufacturers. And then the other piece could be that there are fewer manufacturers, there are fewer diagnostic companies in the US space.
Abbott Laboratories and Quidel were among the first manufacturers to secure FDA authorizations for their over-the-counter tests. According to preliminary earnings from Quidel, the company sold $510 million in COVID-19 tests during the fourth quarter. That's up roughly 27% from the previous quarter. Abbott said it sold $2.3 billion worth of COVID tests during its fourth quarter, up roughly 21% from the previous quarter. Abbott says it has shipped 1.4 billion tests since the pandemic began.
I think maybe the emphasis has been on vaccines for the administration, and I wish that there had been more put onto rapid antigen tests. But there was a lot of effort put into testing generally. It just was in specific contexts. Like there was money made available for schools to be able to set up testing programs.
Federal regulators at the FDA have been ridiculed for not authorizing at-home COVID tests quickly enough to match demand.
There's been some criticism that the FDA standard for these tests is set at too high a bar. So the FDA's response to the criticism that their standards are too stringent is that they might not want to approve a test that's approved elsewhere, or authorize a test that's on the market elsewhere. That for them, ensuring that these tests are a really high standard is the most important piece. The pushback against that would be that, these tests shouldn't be judged against a PCR test. They should be judged on their own or through a different set of standards, and they have a different utility.
The CDC's evolving testing guidance for the vaccinated has also confused suppliers. In March of 2021, the agency relaxed recommendations for vaccinated Americans as more people gained access to the shots. If you were vaccinated, the agency said you no longer needed to get tested after being exposed to someone infected with COVID-19. As testing demand dwindled, manufacturers began to ramp down production. In July, Abbott slashed hundreds of jobs at its production sites amid a significant rapid decline in testing demand. Abbott told CNBC that it's rehired for some of those positions with the aim of producing 100 million tests a month. Abbott said those tests will support federal, state, and local governments, as well as employers, schools, and retail.
When we looked at some of the federal financial documents that manufacturers filed, we found them saying, look, the CDC is saying that if you're fully vaccinated and you've had a close contact, you don't need to test. And there was a clear correlation between that and the manufacturers feeling like, well, we can't build up this huge supply if vaccines are rolling out and they're going to be widely available. And if there's a large uptake, there may just not be a demand for these tests.
And then Delta hit, and then people want to test again. And school started going back into session. People want to test for that. And so all of a sudden there are no tests on the shelves.
The COVID-19 vaccines have been found to hold up against the Delta and Omicron variants. By early August, as schools returned and offices reopened, the CDC reworked its guidance to recommend even fully vaccinated people get tested after a COVID exposure or before holiday gatherings.
It's a bit of a perfect storm. You had people going into the holidays where they were quite likely going to engage with people from outside their household. You had Omicron surging, so we had this more infectious variant. And then you had a shift in federal guidance, but also media coverage. And so together, all of these things, I think, really drove awareness of and desire for home testing.
The acute shortage in at-home tests has prompted the federal government to take a number of steps to boost supply and ease costs. In November, regulators at the FDA streamlined the process for authorizing at-home COVID tests.
So without changing these metrics too much, the FDA has taken steps to try and make the U.S. regulatory environment more friendly to manufacturers. And this is happening in a few ways. So first, working collaboratively with NIH and CDC, the federal government is seeking manufacturers with tests available outside the United States and exploring whether those diagnostic companies would want to come in and seek U.S. authorization. The FDA has also said that they're prioritizing review of certain tests, and that includes home tests, and particularly home tests for manufacturers with the ability to scale up.
The administration struck agreements worth $3 billion in the fall to help bolster staffing, add production lines, and ramp up supply. That investment is starting to pay off. The White House expects 375 million at-home tests will be on the market by the end of January, up from the mere 24 million available in August. The U.S. intends to buy 1 billion at-home tests that Americans can order directly through a government website free of charge. On top of that, private insurers and group health plans are required to cover the cost for up to 8 over-the-counter tests per person per month. But the question remains, will that be enough?
There's substantial supply coming into the market. Abbott's talking about producing up to 1 million tests per month. And I think with respect to trying to make them available to consumers, it's still cumbersome to purchase a test if you can find it and file an insurance claim. I think we really should be in the setting of these waves of infection when we know that we want more people to be doing routine testing. We really need to find ways to push them out to consumers. Consumers who are going to seek out the tests and file an insurance claim aren't the ones who are having trouble getting access to the tests. It's the ones who aren't going to be able to find the time to do that.
In the United States, we haven't had federal guidance on how to make testing a regular part of your daily life or your daily week. And a comparison is the UK, where it's recommended people over 11 test twice a week. And in the US, if everybody over 11 tested twice a week, we would need 2.3 billion tests per month. And we're not there.
As we've seen the virus continue to evolve, we've seen what happens with these variants. So I think all of the testing companies have to continue to have capacity available because we don't know what's going to happen this time next year.